Okay, so now that we've gotten through the depressing part of the talk, let's talk about how do we offer a solution. Is there a light at the end of this medical tunnel? So let's start with myth number 4, that effective primary care can only be measured through an extensive database analysis. Remember, that's the current systems that we have really have almost all rely on extensive database analysis of disease states in order to arrive at quality. And again, as based on the evidence that I showed last YouTube video, that is not necessarily the best way, because at this point we have no evidence to suggest that's actually helpful in the long term. In fact, the best way to measure effective primary care is to simply ask the patient. When you go back to Wasson and Moore's 2006 article, again, Introduction to Technology for Patient-Centered Collaborative Care, the definition for patient-centered collaborative care is the patient being able to say, I get exactly the care I want and need, exactly when and how I want and need it. And that's it's pretty important, and I'll show you why in a second. But when you have a patient that says they receive exactly the care they want and need, what they're really talking about is, do I receive good continuity? In other words, do I have a doctor who knows me and knows my medical condition? Also, do I get good access? Do I have to fight for an appointment, or can I be seen when I want to be seen? Another attribute of effective primary care is efficiency. Do I have to wait for hours in the waiting room? And also good information. Do I get good information? Then finally, of course, is, am I confident in my own self-care? Do I understand my diseases so that I can take care of them in the 99.9% of the time that I'm not in the doctor's office? When a patient says that they have, or they get exactly the care they want and need, exactly when and how they want and need it, if you look at those patients, what you'll find is that, and this is no surprise, if a patient has a bunch of different diseases, then they're far less likely to say that they're getting exactly the care they want and need. Also, if they're not exercising well, if they smoke, if they're poor, all of these things go along with patients not feeling like they're getting good care. And of course, that the mirror image of this is to ask them, do you feel like you're receiving perfect care? If you say, generally, if they say that they're not getting exactly the care they want and need, then of course they're also going to say that they're not receiving perfect care. So that's not a surprise there. But what if you could get your patients to say that indeed they're getting exactly the care they want and need? If you look at that, then what happens? And this is what's pretty amazing. If patients say that they're getting exactly the care that they want and need, if they agree with that statement, then if you treat their pain gets better. If you treat their depression gets better. If you treat their blood pressure is more likely to get better. Their cholesterol is more likely to get better. Their blood sugar is more likely to get better. They're also more likely to have bowel cancer screenings, less likely to have problems from medications, less likely to miss work, less likely to go to the emergency department. And again, remember, all of these different things are coming back from just the one question. Do you get exactly the care you want and need, exactly when and how you want and need it? So there's no need to track all of these different components when one question is like an overarching question over everything. So the question then becomes, well, is there a simple tool to measure this patient-centered collaborative care? If indeed this is really the key to determining how satisfied a patient is, and secondarily how their medical care is going to be, then is there a simple tool to measure it? And the answer is yeah, the online survey How's Your Health does this very well. The nice thing about How's Your Health is that it allows patients to answer in their own homes. They just have to have an internet access. It gives good education based on the information that they put in. So if they put in that they have hypertension, then it'll give them readings on high blood pressure and how to exercise regularly and eat right and do things like that to help get their blood pressure down. It also, which is a real key component, it emails an action plan to the provider. So the provider will actually receive something in their email that says, yeah, this patient took this thing, and here are their results. So you can then make an action plan based on the results of the How's Your Health survey, to be individualized to the patient. Because there are national norms for How's Your Health and the questions there, that the provider can see areas of strength and weakness. Do a lot of your patients say they get exactly the care they want and need, or get perfect care? Or are you not even coming close to what national average is? Here's an example of an action form that you would be emailed from the How's Your Health program. What we find is that when patients do take this survey, about 75% of patients are high functioning. And that just means that they know what's going on, they don't need any additional help. So basically what we did in the Ideal Medical Practices cohort study was we just basically gave them good information and continued the care that we were giving them. 10 to 15% of patients were what we call transitioning. And that, what happened with that was, usually it's a patient that just was recently diagnosed with diabetes or hypertension. And so they're not exactly sure of what's going on with them medically, and they just, and they just need a little bit of extra help. And so what we had was a telephone coach to help with problem solving and help with education. And then what you find is about 10 to 15% of patients are low functioning. And the theory there was to go ahead and do the problem solving, the good education, all the other stuff, but then also do group visits to help them out. So how can you improve your practice with How's Your Health? Well, you get the data, you find the weaknesses. So if indeed the data from How's Your Health says that, for instance, your patients who have COPD are not confident in their disease state, then you start doing an education process where anybody that comes in with COPD, you start educating them on what to do, how to use their inhalers, et cetera, to just improve their confidence, so that then you can hopefully get a better score, and then you pick another area, just one problem at a time. Is it a better tool? Well, let's go back to the same graph, and the neat things about How's Your Health, the data input is by the patient. Why is that neat? Because that means that it costs the practice nothing, which is really nice compared to having to hire a staff member to enter all the data. The focus is the patient. It's asking the patient how they feel, which is, again, goes back to the crux of the doctor-patient relationship. It addresses multiple determinants because it asks them, do you have enough medication, or do you have enough money for your medications? Do you feel like, it asks them about alcohol, it asks them about multiple other things other than just their hypertension. Are there baseline standards? Yes. Do better results equal better quality? Yes, it does. There's no question. And is the doctor-patient relationship enhanced? Absolutely. Because what happens is you get good information and can then work together with the patient to achieve a better outcome. So I'm going to stop here. I know this was a shorter YouTube video, but I'm going to stop here, and then we're going to get into smaller practices and talk a little bit about that.